Facebook and to our viewing audience on YouTube and also to our podcast. Welcome, Dr. Aaron Chapa to KHEA Radio 99.5 FM.
What's up, man? It's nice to see you.
It's been great. It's a great day. How are you doing today, Dr. Chapa?
Man, it is, honestly, it's been nice. This morning was foggy, not as foggy as yesterday morning. Yesterday morning was pretty foggy, and so much so that it was like dew on my hair when I got back to the house after a 20-minute walk. It's crazy. But, today's been just off to the races. I feel like, have you ever just had those days where you just feel like, man, I have not stopped since I woke up this morning?
That's every day for me.
Yeah, pretty much.
Yeah.
But some days it seems all the more apparent, right? And we still are very much, somebody said this weekend to me, they said, yeah, pretty much once, Harvest Day happens on the 1st of November, boom, it is Zoom time for a sprint race to the end of the year, and it's just like a teleport to the end. So do whatever you can to slow down.
It feels like New Year's was literally just yesterday.
It has been a fast year.
It has been a really – that's crazy. And I saw someone on TikTok actually said, like, it feels like as you get older, the years go by faster.
Yes.
And I was like, huh.
Has it happened to you?
I think so. I'm starting to feel that way, that it's just like, oh, I've been in Texas for 7 years. Like, that seems
crazy.
That seems crazy to me.
Right.
Because it was just yesterday, it feels like.
Well, we've been in our new building for just over 90 days. And so, I mean,
it's been 90 days?
It's wild to go, wow, that was fast.
It was yesterday.
I know. And
That's
people
crazy.
say, has the new worn off yet, or are you still really enjoying it here?
Right.
I'm like, oh, hands down, no questions asked. It is absolutely rewarding every day to just see what God has done in our lives as a clinic, in patients' lives as we continue to expand and grow and just impact people, for the betterment of tomorrow. Like, we know that if you don't have the longevity plan, if you don't know what you want your life to look like after you've built it in all areas of life, spirit, mind, and body, we know that you need coaching and teaching. We teach people you've got to have an end goal. You've got to have a plan. People never plan to fail. They just fail to plan. And we've got to help people see that that they can live a different life today in order to impact their world tomorrow. They can spend the time maybe that their parents weren't able to spend because they're healthier and stronger. They won't be in a broken place. And I get it, like things can happen that can set us back or derail us, and that stuff happens. But when it comes to living well, there are things that we can do and we can choose to do.
Yeah, so if you are watching on Facebook right now, you can actually drop some comments. You can ask a question. We're going to be taking questions all day today. We're going to be answering those questions because as the year comes to an end, you're going to have different things that are happening to your body. We've talked about it in past episodes that the seasons change, your body changes too, and how do you adapt to those? What kind of ways can you help make sure that your body is staying functioning the best that it possibly can? So go ahead, if you're watching right now, go ahead and comment. Go ahead and share this out. Tell a friend, like, hey, tune in, because you never know that one person may be having an issue that this episode could help solve that issue for them for years and keep them on this planet, keep them healthy, keep them going. And that's the ultimate goal of this podcast, the ultimate goal of these episodes.
Absolutely. To maximize all aspects of health in any way, shape, and form when it comes to your energy, your vitality, and your longevity. That's the ultimate fruit. And at Living Well, it is your life, your health, your choice. We want to help you make a good choice each and every day. How you start your day will impact how your day goes and how you end it. And so, join us and continue. We have some cool things coming up. This Saturday, we have the fun run with Anchor Point Ministries. We're really excited. The Run for Health program over at Gloria Day Church in Nassau Bay. We hope that you guys will come and participate, enjoy the morning, enjoy the energy that's there. This is a great event. It's a great fundraising event. It's a great just time to be out in the community, rubbing shoulders with other great people that are, early bird gets the worm.
Can I first, the idea of fun and run together, like, first of all, that just doesn't make sense in my head.
Yeah.
I'm sure it doesn't. And people realize, like, no one's forcing them to run, right?
This
like,
is true. There's nobody chasing them. This is a voluntary activity, and it's amazing to see the number of people that go out and do these fun runs. And it is exciting. You could dress up like a turkey. You could dress up like a gorilla or something to, like, kind of run around.
Like a turkey trot.
You could do a turkey trot. You could make it whatever you want, Kurt. And we hope that we would love to see pictures of this. This would be great. But November 12th, first thing in the morning, make sure that you get a hold of us at anchorpointministries.org, and you can give them a call and get more details, but definitely be a part of that. And then this following Tuesday, the following Tuesday, the 15th, we have the Living Well holiday baking class.
That looks exciting, by the way.
I know. And the coolest thing is we're going to do it without refined sugars. And so it'll be at 322 East Main Street at 6:30 p.m. And we hope that you'll come enjoy, partake in the taste and the smells and the education that we're going to be laying out for you so that you have options that are going to be healthier and still very sensationalized to your taste buds.
You know, I know a gentleman, and you know the gentleman as well, but he's lost 30 pounds probably in like 2 months, and the only thing that he changed was he eliminated sugar from his diet.
It's amazing.
The only thing that he changed was no more sugar, so he only,
sugar
tea,
is very
stuff,
inflammatory,
yeah,
right?
yeah.
And what happens is the nature's solution to pollution is dilution. So the body will hold on to fluid in order to deal with the concentration of the sugar's impact on our arteries,
right?
Sugar's impact on our brain, on our nervous system, sugar's impact on our muscles, our joints, our organ systems, how your body manages the fat reserves. It's amazing that, if sugar was allowed into our society today, many people would agree with me that it would be a controlled substance. I remember, one time, and it's just due to good marketing. I mean, we had a sign outside of a booth, why do I crave sugar? And people would walk by, sarcastically, because it tastes so good, But you have to remember, nothing below your taste buds want that kind of inflammatory response, and it's very detrimental to your long-term health. We have documents, and Nancy Appleton talks about in her Lick the Sugar Habit. She says that there's 146 ways that we know sugar impacts and ruins our health or destroys our brain or messes up our longevity curve. So if you do have a plan to live well, be well, and stay well, you've got to be mindful of the type of sweeteners that you're putting in your body. And this is just speaking to the obvious high fructose corn syrup, the obvious white sugar. But, I mean, of course, there's artificial sugars we got to avoid and other inflammatory poisons that happen to be sweet that we've got to teach people and show people. And we'll discuss a lot of these things at the holiday baking class coming up on the 15th at 6:30 p.m. at Living Well Clinical Nutrition Center at the Main Street Event Centers, where we're going to be hosting it. And so we're really excited that you guys we're taking you into the holidays with us, and we want to give you tools to maximize your holiday experience and really just try something different. Do something new and see what kind of response you get.
What are you cooking at the baking con? Is it a contest? Like,
No.
There should be a contest.
There should be a contest.
Right.
No, this is just a educational class. So, there will be delightful. Is the word delectable? I don't know. Delightful treats available that you can tickle your taste buds with. There will be some good smells in the room, baking in one of the ovens in the back. We will have great education, to share with people. So you definitely want to be a part of what is happening at Living Well Clinical Nutrition Center, especially as we start getting back in the groove of having our monthly classes and getting set up for detox coming up in the new year. So we're just fired up and excited about where the transition of life is taking us to. So, man, stay tuned, stay with us, and be a part of what we're doing, because together it makes it more fun. Together, that's where the fun part comes in the discipline of training or exercising or walking or running. That's where the discipline comes in, and it's not such a discipline. It's not such a pain whenever you know that there's a tribe of people that are walking alongside you, doing it with you and teaching you and running these experiments in their own homes. We are putting these recipes to the test. And don't get me wrong. I mean, everybody likes a good sweet treat. But man, if you could find some sweet treats that didn't destroy your body, man, you would be a little bit more apt to indulge and not feel guilty.
Right, 100%.
And so that's a good place to start.
And I will say that because of Dr. Chapa, before I met Dr. Chapa, there are recipes that I would have never been able to cook. And because of the classes, some of the cookbooks and stuff, when we do the detox, I've learned how to do that, and I do it all the time.
And I think that's pretty awesome, Kurt. I love it.
All right, so we got some questions. If you're tuning in right now on our Facebook page, go ahead and drop a comment. Ask a question. If you have something going on in your body, we want to get those questions asked. But we have a couple questions that were already asked ahead of time on either Instagram, so go check out Living Well's Instagram page. You can do that at KHEA Radio as well, and we'll try to get all those. We've gathered some of those throughout the week, and then we're going to ask those questions today. But first, we got to get to this one, Dr. Chapa. Dental care, fluoride, cavities, root canals, nitrous, how to prepare for a dental appointment and to recover. It is so stressful, and there's so much I do not know. First of all, I will say that I probably haven't been to the dentist in a long time, so I'm interested in this conversation. I don't like the dentist either.
Yeah, and most people do not like dental treatments. They don't like dental visits. They just kind of like do what you're talking about, sweep it under the rug and be like, yeah, I'll deal with that some other time. And
as long as I'm brushing and flossing, I should be good.
That's right. I remember the old saying that says, which teeth do you want to floss? The ones you want to keep. And so there is value in the in making sure that you do have good, proper dental hygiene.
Yes,
right. And so, but it is interesting to me. There's a few things that I'd bring to the table. Okay, so like when I was a personal trainer at a gym, I found that my method of training was a little different from what I was taught in the books, and you have to tailor training methods to the person that you're dealing with. So I wouldn't treat a 60-year-old, person that I was training like I would treat the 25-year-old or the 35-year-old, because everybody's at a different fitness level. People have different, abilities, that they're strong suits, and they have different areas of their life where it needs a little work. Well, I would say the same as there's some key principles that are the same, but you may find that some of the principles that I work from, they're not necessarily paramount to your proper dental care. But I would say it's worth having some of these tools in your tool bag and experimenting with them for 30 days and see how you feel. I've been in classes that said the name of the class was "Kiss Your Dentist Goodbye." Interesting. She was very much an advocate for not flossing, believe it or not, and not doing some of the dental hygiene that I have personally found that is a necessity for myself. The cleanings were more detrimental, and to some people's chagrin, I mean, when Weston A. Price went out and was looking at teeth, there are tribal cultures where teeth, where domesticated people versus non-domesticated people would have their teeth evaluated, and the people that lived off the land, interestingly, that did not have access to the abundance of sugar, processed food, liquid sugar, energy drinks, etc., they didn't have access to toothpaste, toothbrushes, and all the oral hygiene antimicrobials.
I've always wondered that. Like back in the day when Jesus was walking around, they didn't have dentists back then.
Right. So and interestingly, they also had the same number of teeth we have, and they weren't getting wisdom teeth extractions. They weren't getting, like, I had
cavities.
A dentist recommending my child when she was young to have 7 of her baby teeth removed. I've had this recommendation to a lot of friends and patients and I've been able to talk them out of it and say, no, we don't want to be pulling teeth. That is not the answer. The answer is or the question should be, why is the mouth so small? Why, because God didn't mess up. He doesn't give us, oh, here's some extra teeth. No, I mean, we know baby teeth are going to fall out, but why did he give us all these baby teeth if they're crowding and there's issues? And that comes down to the domestication that Weston A. Price Foundation found when he was going around as a dentist, looking at teeth, evaluating cultures, looking at habits and ways, lifestyles. He saw that the non-domesticated people that did not have access to all this stuff, they had nice wide palates. Their teeth fit in their cage, if you will, inside their mouth. Their tongue did not suppress the airway in the back and restrict airflow to their brain and cause all these learning disabilities and all these developmental disorders and slow the development process. Whereas the domesticated people, the people that had access to the technology of the world,
right,
they had the narrow mouths, they had the cavities, they had the crooked teeth, they had the issues and the gum disease and all the stuff. And so, and not to say that those people probably didn't have cavities, they just were fewer and far between because they didn't have all the fertilizer to feed bacteria in such a way that it could destroy the mouth, destroy the teeth, destroy the gums. And so we've got to just appreciate like where we're at in a culture. We are all living in a culture where sugar is abundant. Whether you avoid it or not, you still get into it.
And it's
right.
Right. And the crazy part about the teeth is that it is the first thing that people really recognize about somebody. There was an ad that I saw a long time ago. The dude was missing an eyebrow, but he was missing a tooth. He was missing a tooth.
He was missing a teeth?
He was missing a teeth. He was missing a tooth. And the first thing that you notice is you notice the tooth. You don't notice that he has one eyebrow, And
Yeah.
so it's just, they're like, get your teeth checked,
That's
take
right.
care of your teeth, because that's what people recognize when they first see somebody.
They've done centenarian studies on the mouth. I mean, there's many sayings, right? Like whenever they look in the slave days, they said evaluate the teeth. When they're buying animals, They look at the teeth. That when we adopted a pet recently, and they immediately looked at the teeth and said, "Oh, the gums look healthy. You got a good animal." And I'm like, wow, and we still do this stuff today. So the teeth tell a story. They tell a health history, and you can quickly evaluate that. Centenarian studies have shown that if you want to live to be 100 years old, fully functional, this is important, fully functional in spirit, mind, and body, that you have to, number one, have something to live for. You have, and number two, the common thread of all these three common threads in all centenarians, something to live for. They had no issues with their teeth, and they weren't on pharmaceuticals. Interesting. And so there's a place where we start looking at people's lifespans and their quality of life, and they do all this analysis. And these are like big studies. These aren't like little bitty studies. And they found that if you've got something to live for, no issues with your teeth, and no pharmaceuticals, your chances of being in a place to live long, healthy, fully functional in spirit, mind, and body is higher percentage than if you are somebody that is, not so much in those three categories.
I got two of the three.
Oh,
I'll
yeah?
let you decide which one is not.
Oh, I definitely. Yeah. Let's just keep going because I could go a couple places. But I know it's not the dental issue. The dental issue because you said you don't go to the dentist, so you don't know if you have any issues with your teeth.
Well, I can say this whole time that we've been talking about teeth, I've been playing with like my bottom jaw, because like from the time I was a little kid until I was like in the first grade, I was sucking on my thumb, so I have this little gap in between my bottom and my top teeth. It just drives me crazy all the time. And I never did braces or anything like that, but the whole time I'm just sitting here like, golly, I shouldn't have sucked my thumb when I was that young,
Well, there's that. And so, but at the end of the day, this is where we are. So we're setting the stage to answer this question, because it's not a easy question, and that's why it's so confusing. That's why it's so challenging to kind of like figure out what works for you. And so I remember a time many, many years ago, I was diagnosed with having a deep pocket in one of my teeth, which is the gums being basically inflamed beyond a measurable health status. And I'm thinking, I eat really healthy. Something's messed up about that. And I did have braces, and so my mouth was fine. But of course, I didn't wear the retainer, and the teeth has shifted a little bit, whatever. But what has happened for myself, in going into this area, I saw that pocket being inflamed, and they said, "Oh yeah, this is periodontal disease. We're gonna have to send you to a periodontist, a gum disease specialist." And I'm like, "Whatever." And so I said,
see you saying that to them, like as they say that to you, you're like, "Oh, whatever."
Yeah, it's like, and so I said, "Give me 3 months, I'll be back, and then we'll check it again." And sure enough, 3 months later, I come back in, and I got a pocket that is in the normal range diagnosis. And they were like, "How did you do that? We've never seen that happen." And I'm like, "Well, that's what we do. We at Living Well give people alternatives to drugs and surgery and the common methodologies that people are doing." And I just recognized, I started analyzing my teeth and thinking about intention. Like, what do I need to do in order to, one, reverse disease in the gums, right? So, disease is definitely always lurking in the shadows. Our body is our mouth is a melting pot of potential infectious brewing sites because of the many crevices, the limited blood flow in and around the teeth and the gums, and because it's all small, what we call microvascular tissue. And so I had to start doing flossing 3 times a day instead of once a day. I had to start incorporating water pick techniques twice a day to keep the gum area flushed and clean in order to just not allow bacteria to make a haven for themselves, build a mansion in my gum tissue. I had to start had to change the toothpaste again and start looking more thoroughly at the different things that I was using. And then I started incorporating some of the techniques that I give people when they go into the dentist in order to not have to use antibiotics when they go in for a dental cleaning. So many dentists today will make people take antibiotics whenever they go in for a simple cleaning. So we're going to blow up the gut at the expense, because we're worried about the little bit of irritation that we're going to create when we do gum, that they're going to get an infection. So we got to preemptively put them on a multivitamin, if you will, or multi commonality, not even of an antibiotic. But that's the worst advice ever. There's better techniques and tools. So where it starts for me is when I know I'm going to the dentist, I do go twice a year to get my teeth cleaned. I like it. And so for me, I found one of my dental practices is to have my teeth cleaned, and it feels good. And I have always noticed that, my gums are healthy and strong, and my teeth seem to be healthier and better since I've incorporated that. Sometimes even if I feel like it's maybe for whatever reason, I don't feel like things are going well, I'll go in even earlier. I'll try to get on a hygienist books to go in earlier and get my teeth cleaned. And a part of it, there's again, I go in to the cleaning experience, knowing that I'm doing my home due diligence. So in the morning, I floss. I brush my teeth with a whether it's a Sonicare or an Oral-B, some sort of ultrasound wave technology toothbrush, because that technology disrupts that frequency disrupts bacterial havens, and it changes the ecosystem in the teeth, in the gum tissue and between the teeth, and it helps break up plaque and all the other food sources for these bugs to just sit and chill. And obviously, going into this, I've already addressed my diet. I then twice a day, morning and night, I use a water pick, and I don't even water pick have to water pick every one of my teeth because I floss twice a day. But I will literally take a water pick and one of the portable ones, because that way I know it's like a 30-second rinse, and I focus on the areas in my teeth that are tight, where I have tight junctions, and food typically gets stuck, and it's on my upper molars, and so I'll come in and flush those tissues really effectively with the water pick, and then just a little bit of floss up in that area, and that will keep my closed gaps, my tight junctions, areas where my food gets stuck. And everybody knows this. You know when you have areas in your mouth where food gets stuck. Those are areas where you're going to have more of a predominant buildup, so you got to emphasize those tissues and work on that area a little bit more. And then I chase that down with the brushing, and the brushing. I really think you could just use a Sonicare or an Oral-B Sonic kind of toothbrush in order to rinse your mouth out with warm water, and you'd be fine. I mean, that would create an amazing shift in plaque formation and and getting rid of those food sources for the bugs. And then we would come. But if we were going into the dental cleaning, I would that morning, or in any oral procedure, actually, not just the dental cleaning, but any oral procedure, the thing that I do most with people is I'll have them take baking soda and hydrogen peroxide, and they'll take the baking soda and hydrogen peroxide and will gently brush their gums with the baking soda, and then put the hydrogen peroxide in, and we're talking 2 teaspoons, just enough. And we'll put it in the mouth, and we'll let this chemical reaction drive oxygen down deep into the tissues. Oxygen will disrupt bacteria that that are what called anaerobic, that do not want oxygen. Oxygen is a poison to them, and we can kill millions and millions of bacteria very quickly orally before you go in for your dental procedure. And then you go in, you have a predominant reduction in microbes. They can do their due diligence of whatever you have to have done. And then when you come back out, depending on the severity of what they did, you could even do that treatment one more time that evening and the next morning. And you have essentially kept a clean mouth so that you can heal faster, heal better. And I don't, if it was just a standard, cleaning, you could just do it in the morning, the hydrogen peroxide and baking soda on the gums. And you just, again, you're gently brushing the gums. You bring the hydrogen peroxide in. Once you start feeling achiness in the gum tissue, that's when you know you've killed, quite a few bacteria. You got a lot of oxygen down deep in there, and that's when you rinse. You just rinse that out, and then you go about your towards your visit.
Going back a little bit, you talked about brushing your teeth and using the water pick and stuff like that. A few years ago, I had a conversation with a dentist, and I use different toothpaste and stuff like that. And at the time, I think I was using like a 3D whitening Crest or whatever toothpaste. Sure. And he talked about the concerns of people who are using whiteners, people who are using those kind of like 3D white, where it says like, hey, this will make your teeth whiter in the toothpaste because your teeth aren't designed to have that wear and tear. And he's like, I'm concerned in 20 years from now, if we continue to use these products, what are our teeth going to look like? Because you're wearing away at the different components of the teeth. And I was like, I never even thought of that. It's like, I want white teeth.
Well, and you gotta think what is causing your teeth not to be white, right? It's stains from the foods we eat, but there's if you will, a clear coat over the teeth, and then you're taking this toothpaste that's a hard shell of a rock of sorts and different types of minerals that will come in there and grind on all that clear coat, if you will. And he's right, like you can disrupt and wear down the teeth too quickly. I mean, it's bad enough that people are grinding and tearing their teeth up that way. And again, the teeth are a sign of so many things, and just having some tools to go in. So, I'll have people take Congoplex, 3 times a day, 2 days before a visit, 4 days after a visit, so it's a total of 6 days, in order to boost up and strengthen their immune system. Then I have them do the hydrogen peroxide, baking soda treatment before and after their visit. I'll have people incorporate, especially because I just see so many people that have like really chronic health issues in other areas. They're not their teeth, but their teeth are an underlying causal link in the chain. Right. And it's like a fuse on a fuse box. You've got to evaluate everything. And the teeth can absolutely be a haven and a causal link in the chain for where these bugs are hiding. Too often, we find people that need this type of treatment and care only because they neglected something else upstream. that nobody said, hey, that could be a tooth issue. Let's address it when it was a weed. Now they've got this oak tree of problem, and they have to have a tooth removed, or they have to have an implant put in, or they have to have some sort of other, aggressive, barbaric procedure in order to keep those pearly whites pearly.
Yes.
And so, I use, so just on the fundamentals, right? I use a Sonicare toothbrush or an Oral-B toothbrush that has that kind of sonic wave potential. I use a toothpaste that it has xylitol in it that does not have fluoride. I do not want that fluoride in there. People go, oh, but you want to harden the enamel and harden the teeth and da-da-da. And but the fluoride is poison. I mean, it's not good for our bodies. Oh, but you're just brushing your teeth with it. Look, nitroglycerin can slip right through the mucomucosa and support the heart in an emergency situation of in like a cardiovascular incident. Your mouth absorbs nutrients very quickly. And so to think that you can put a small poison in your mouth every day, twice a day for your whole lifespan, and it not have some negative impact on your brain tissue, your nerve tissue, is crazy talk. And so I want to encourage people to avoid fluoride and just take care of your body's mineral needs. I talk to patients every day about the importance of minerals. Without minerals, your cells will not be electrically active. You've got all this potential energy, but no engaging of the energetic clutch, so to speak, and you don't get the output because your minerals are low. And if your minerals are low, it's going to sooner or later begin to deteriorate other bone tissues and make brittle bones in the teeth as well. And so fluoride is not the solution. It is a solution that they found works, and it does harden the tissue. Nobody can deny that. But at what expense? And that's where we come in and say we give people alternatives to drugs, surgeries, and poisons. Just because it's marketed as healthy for you doesn't mean it is. And so I always will, go to bat for avoiding poisons even a little bit, because, I'm sorry, a little bit of cocaine is not good for you. A little bit of sugar is not good for you. It's a controlled substance, and a little bit of fluoride for sure is not going to serve you. And so if you're still using that stuff, we want to educate you better, and we want to help you get off of it. It's just, and see, like, these are the ways that you take the burden from the environment off of your body by not putting underarm deodorant that has aluminum in it, that doesn't have fluoride in the toothpaste, that isn't loaded with all these cancer carcinogenic creams that we rub all over our body or our skin and our hair. And we've got to be careful, guys. I mean, these are things that we can learn and approach, and it is seemingly overwhelming if this is the first time that you're hearing this. But here's the deal. Start somewhere. Start by changing your toothbrush and your toothpaste. We use a company called Xyclear, and it's a xylitol-based toothpaste, very clean. A lot of these essential oil companies have really cool essential oil-based tooth care products. You just got to make sure it doesn't have fluoride in it, and make sure it doesn't have artificial sugars in it like sucralose. And whenever you avoid these key negative ingredients, you've got a clean product that's clean enough.
Right.
There's so many valuable tools that essential oils can offer and disrupt ecology in the mouth, just like herbs I use therapeutically to help disrupt the ecosystem whenever we're dealing with bacterial or fungal or viral overgrowth. And so we don't want your body to be burdened with these poisons. So just start with a good toothbrush, start with good toothpaste, then incorporate floss. Do you want wax floss or do you want dry floss? The goal really is to be at the dry floss level where you can actually go into the teeth and you can hear the squeak, 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 squeak. Oh. And that means that you have cleaned all the gunk off the insides of the teeth. But man, if
I'm not a squeaky kind of guy.
You're a waxy person, hey, use the wax. It's better than nothing. You just don't want. You want to disrupt the biofilms in the teeth. So like when we're taught to, I was taught to care for our pool. It isn't just simple enough to have the chlorine right in the pool. You have to scrub the sides of the pool to disrupt the algae biofilms, like their little protective shells. That way, the salt generator can get that chlorine level to a point where it can disrupt and kill off the algae that's trying to build up continually in the pool. Well, it's the same in your mouth. That's what, you're going in there and disrupting with the Sonicare toothbrush, the toothpaste with different oils in it, or just, a simple toothpaste. That does not have fluoride in it. It doesn't have artificial sugars in it. And then the floss, you're disrupting the ecology, and you're keeping blood flow attentive to the gums and to the tissues of the mouth in order to keep dental hygiene on the up and up. Then by incorporating the water pick, one of the most underutilized tools. It's very easy, very effective, and again, it's like literally 30 seconds and you're done. And it's time in the saddle, not once a week, not once a month. It's every day, at least once, and that will disrupt, trash, especially if you do it in your night cycle, from bacteria having food debris built up in the tissues to eat on all through the night while you're sleeping. And so it's a great time to go into your little nighttime slumber and have a clean mouth, because the bugs don't have time to formulate big colonies. And so I have found that when people will follow this little practice of water picking at night, flossing in the morning, doing their general brushing twice a day, they are in a far better place if that's the simplest approach they take.
That's good. That's awesome. That's great information for anybody. If you are watching right now on KHEA Radio, we are live on 99.5 FM. You can ask your questions, and we will get to those. One of the questions while we were talking about like sleep habits and brushing and flossing and stuff like that, a question popped in my head that I don't think we've ever talked about before on this show.
Oh, this is exciting. I can't wait.
At least from what I understand, and this is like 4 years of Dr. Chapa talking.
I think it's 4 years, my man.
I have never asked your opinion. Should you be taking cold showers in the morning or warm showers in the morning? See, we've never talked about this.
Thermal therapy at its finest. So thermal therapy is a powerful, powerful tool. You can look up the Iceman, Wim Hof.
Right.
He's got a breathing technique, and he's people would say extreme, but you got to appreciate what can you glean from the extreme and bring back to normalcy, right? So, because not everybody's going to go hike the, Everest in a pair of shorts and boots with no shirt on. You know what I mean? Like this guy has multiple times. This guy has swam underwater so cold that his corneas froze over and he couldn't see, and he was under 6 inches of ice, and they had two big holes, one on one side, and he had to literally feel his way to the next open hole underwater and not being able to see and when he got out of the water, it took like another 7, 8, 9 minutes for his eyes to come back. And yeah, no, that's crazy. That's crazy making.
Right.
And so God bless him. That's just not where I want to go. However, cold showers in the morning. If you got a swimming pool in the backyard, 5 minutes in a cold shower or in a cold pool, and you learning how to do breathing where you're not back in the back, tripping out and making all the the fanny noises, and you get in that water and you breathe into that space and you feel the intensity, it will change the dynamics of how the lymphatic system moves, your blood flow moves, and very anti-inflammatory practice. It is a great tool, great technique to jump in the water. And if you're thinking to yourself, that sounds easy. Well, wait for it. It's not.
They do a polar plunge sometimes, and people in Texas think it's a polar plunge until it's January in Nebraska and there's snow everywhere and you have to jump into the lake for 5 minutes and then come out. Polar plunges in Texas do not compare to polar plunges in the north.
This is probably a true statement. This is probably a true statement. And so when you do find that change in body temperature, and you're seeing a lot of stuff online today with people building their own little ice bath coolers in the backyard, ice bath dunk tanks in the back, and you can get inside these things, and they're like, ice water.
Right.
They're super, super cold. They are valuable. They do help, get rid of inflammation in your joints. They do they cause a restriction to occur in your blood flow, and then when you start to thaw out, you get this nice blood rush, and your body just feels alive and vibrant. So it stimulates a pathway of heat shock proteins in your body that is going to stimulate regeneration, health, and stimulate vitality. It is a great detox tool. It's a great anti-inflammatory tool and a great methodology of jumping into a cold shower. As painful as it sounds, it could be very beneficial for your breathing as you learn to do breath work in that space, as well as you learn to appreciate the cold. And where I would start people is you start with that lukewarm, then you take it to cold for 10, 15 seconds, and then you kind of warm it back up, and you kind of go back and forth, thermal therapy, trying to get it to where you can go longer and longer durations of time in that cold space. Or if you're in a swimming pool situation, just jump in and, find your space, find your center, get one with thyself. And feel the intensity, because that could be something fun we could do. We could find us a nice cold swimming pool, and we could have a group effort. How many people want to show up to jump in and sit in there and shiver like penguins?
I just want to say today on the episode, we have talked about two things that I really don't like doing, and that is fun and run, and then cold showers. Like, those are like
you brought them up.
I know I've brought up both of them. The other question with that, and it's funny because I don't know if Gardy's watching right now, but we've had conversations about this. I am a shower in the morning kind of guy. Like, okay. I'm going to wake up, I'm going to take my shower, I'm going to get ready for the day. I'm going to shower at night, and, then I'll shower again in the morning. Because he's like, I don't want to go to bed dirty, I don't want to go. But I'm like, why am I going to shower and I may be wrong, and I may be grossing people out right now, and I don't care. I want to get the answer. But he showers at night and in the morning, and I'm like, why am I showering at night? I just want to go to bed. Is there, like, in your opinion, as a health professional, doctor, how do you handle, should you be showering at night? Should you be showering in the morning? Should you be showering both times?
I mean, again, I've talked, it goes back to this whole, like, domesticated, non-domesticated space. And I've seen people do multiple different things, and they say it doesn't seem to affect their sleep habits. But the patients that I've talked to in general, and what my practice has shown me, so this is not like, scientific, I've got all this hardcore research on this, but this is what my practice has shown me, is that when a person takes a shower at nighttime, it changes their surface temperature, and it causes some of the blood flow in the tissues head to foot to change, and they can, although come out of a hot shower or a hot bath and be hot going to bed, their core temperature will cool down very quickly. And they have done science research on whenever their body emits all that surface tension gases, if you will, and toxins that are on the surface area, and when they're in that hot shower, they're kind of letting all that open up and port off, and then they go jump in bed. Their body temperature will cool down quickly, and the cooler a person is when they are sleeping, the deeper they will sleep. They have found that that people sleep better in a colder environment, and so they have chili pads that you can put on your bed that will lower your core temperature while you're sleeping to get better quality sleep.
So if somebody's having, like, because I will actually sleep better in a warmer environment. So is that going back to a health check mark?
Well, it'd be interesting. It's interesting, and I would have to go back and go, all right, well, let's just start evaluating. Or, like, what's your warm environment? Is it your thermostat set at 74?
73, 74.
And what happens when you're at 72, 70?
I'm wide awake. And
wow.
It's crazy because even I remember as a little kid, whenever I was hot, I was sleepy. Like, if you're in a hot room, I'm falling asleep. And so I don't know if there's something weird there.
I would say that more often, see, what happens whenever you go to bed, your gallbladder and your liver meridian are ramping up. They're getting ready to do a mass flush and mass detox on the system. And so you can imagine that biochemical factory kicking up is going to kick off a lot of heat. A lot of friction is getting generated. Biochemical processes happening. And so I would wonder if, there's some liver component to somebody that could sleep in a warmer environment, more often than not, I don't know, let's poll the audience. The audience is always right. Poll the audience and see if you do sleep better at 72 and above, or do you sleep better at 71 and below? And is there a number? My guess, based on what my practice has shown me, is that people sleep better cooler than they do warmer.
See, I'm also the person who has like 8 or 9 blankets on in the bed because I like the pressure, and it's really hot. I don't know. And the other thing, like going back to the shower thing, if I take a shower at night, I'm wide awake. Like
it does have a tendency to kind of wake somebody up a little bit.
But that's because for my entire life.
But you got to think: are you supposed to take a shower and then go jump right in the bed, or should you, jump in the shower, do your nighttime routine, and then you've got 30 minutes to read a book or 40 minutes to read a book, and then drift off to sleep?
Maybe. I don't know. Usually, I'm just like, I'm done with this video,
and I'm
jumping into the bed. I'm going to bed.
So I guess the answer to the question for me would be the amount of, the toxins that you're starting to put off all throughout the day. So as I'm speaking, my body might be clammy. The weather might make me a little warmer. This room might be warmer. So my body is, percolating and sweating off trash and toxins through the skin as an exit channel.
This room makes me want to fall asleep. Like, I'm like,
so it's too warm in here.
It's perfect, for falling asleep.
Well, but then again, during the daytime, like at seminars and stuff I go to, they always crank the temp down because that colder environment actually keeps people alert. So, I mean, it's just interesting. There's so much to the sleep game. It's circadian rhythms. It's health of the liver. It's the mineral concentration in the body.
The recovery during sleep.
It's frankly why you need to be under care of somebody that can ask you the right questions.
It's crazy.
And it's like, it's hard to kind of like say, well, what works for one person is going to work for everybody. It's kind of why I prefaced the whole dental question the way I did, because we have to appreciate. I have found for myself these things work. I have found, for people like you, there's always going to be a one-off and an outlier, and people that, they have a completely different experience. But to me, when you listen to the full story, you get the full story and the full history, you start going, oh, okay, that would explain why their body does this. There's some rationale for why their body responds the way it does. What you got? You got anything good over there?
Well, somebody just said that they keep their temperature at 67 overnight.
See, but again, my wonder is more if we left that poll up there, hopefully they'll keep chiming in, is that we would see that more people sleep better cold than they do hot. I mean, so you at 74 or 73 or whatever, like I couldn't sleep in that. Like I remember being in Austin one time. We rented a house at a seminar, and it was like somebody's living house, so it was weird. They kind of left, but they were renting it out for the weekend, and so it's kind of an interesting kind of setup. But they didn't have any fans in the bedroom, and it was an older house for sure. And I'm telling you, it was hot. I didn't even sleep with a sheet on or a cover on, which is abnormal because I'm kind of like you. I kind of I want a little bit of covering while I sleep. But I mean,
8 blankets?
Yeah. I was so uncomfortable. Like I was like sweating during the night. And I'm like, and it was because there's no airflow in this place. And it was just hot. And so I don't sleep well at all in a warm environment. And it's weird. 1 degree can make all the difference.
That's what's crazy about all of that. I actually like if I don't sweat in the middle of the night, like I'm angry at myself. Well, especially when I'm in a weight loss challenge.
Okay, guys, he just gave us the answer. Did y'all catch it? He says, if I don't sweat in the night, I'm angry. Well, when there's anger,
I want to lose weight.
It's all liver.
I want to. It's like
I'm looking. Hey,
there's trash.
Mr. Liver, it's so good to see you this morning. I knew you were in the house, and I can walk into so many rooms and go, "Hey, Mr. Liver, what's going on, Mrs. Liver? Oh, look, there's little Liver. We got a little Liver in the house." And so we can literally go and start tinkering with and changing your liver health, and I bet you would see a change in the way your body responds to the roar.
I don't know if I'm going to ever set my temperature to be 67. I'm sorry, Lori. 67 is...
Oh, well, maybe 67's... I mean, think where you're at. What if that means that your liver is really jacked and her liver is really, healthy, And or what if and Lori, forgive me, I'm not picking on you, but I'm thankful that you're kind of like, I got two extremes.
Two extremes.
You know what I mean? I got somebody
67,
at 67 and I got somebody at 73. And so, if you are somebody that has like hot flashes at night, 67 is probably, warm. You know what I mean? So we might need to do some hormone, cleansing with you, receptor detox, and where the hormones can sit in the receptors appropriately, and we can get good lock and key and hormone exchange, throughout the day, so that your body's not running so hot. If you're having hot flashes, night sweats, things like that. But then we got you. Toxic man, Mr. Toxic.
I am not full of toxins.
Oh, I think you might be. So, but it's a great story and a great question and a great conversation to be had.
This was great. This was I didn't expect this to go this way. And the final thing else I wanted to bring up, in those environments, it's interesting when you can be in a room with people, and to them it may be cold, and to another person it may be warm, right? But it's the same temperature. And it's just funny to me because I'll be upstairs freezing, and somebody else will be as warm as they possibly can. I'm like, change the temperature in here. That's why people will walk over and change the
thyroid metabolism, liver health, toxicity. Are they sick? Are they not sick? What's their mineral load, concentration? Again, I'm always trying to teach patients to read the signs. If I walk and I'm constantly hot everywhere I go, and I can never, I'm borderline sweating, I know my minerals have to be off at that point. I look at minerals like mineral tranquilizers. They're like the flame retardant to inflammation. And so I would start looking at my other signs and symptoms. So am I having Charlie horses, cramps in the legs, feet, arms, or hands? And if I was, I'd go, I need some more minerals. If I was noticing that I was having a harder time falling asleep, or if my legs were restless only when I'm in bed, only when I'm in bed, that's a mineral problem. And so I would start helping people hunt down their mineral problems and start restoring those. Nutrient replenishment is a powerful restorative key to longevity, vitality, and energy. And we want to give you that support. That's what we do when we support the roots of vitality, is we're getting in there and we're giving you the vitamins, minerals, essential fats. We're taking the burden off the tissues, and we're getting the cells to upregulate and to work together so that you feel good. And who doesn't want to feel good?
Yeah.
I mean, that's what's so beautiful and powerful about, the vitality tree that we teach at Living Well, is that you can feel better than you are today. You don't have to stay stuck in the rut that you are. And we're just talking about some simple questions, and there is no exact answer, in a blanket statement. Like, all right, everybody needs to have this and this and this, and they got their health. We've got to uncover the stones that work for you and your gene code, your family tree, your lifestyle history, the things that you've been through, and what we need to do to get things running cleanly so that your body performs its best day in and day out. And your body will change. Your body, Kurt, would change if we could get you to do, say, 70, 80% of a program that we teach. You'd be like, oh, wow, I didn't realize my sleep could be better. I didn't realize my energy during the day could be better.
I'm going to have to start with the cold showers in the morning.
That's a good place to start. I think it's a great idea. So, at Living Well, we're always out to give new updated information. We're always trying to just give you tools to empower you to be the best version of you possible. And so give us a call, 281-554-8600. Visit our website at justlivewell.com. If you are wanting to go deeper in your health, if you're wanting to take the bull by the horns, if you're wanting to get answers to why your medical illness is not being resolved with the pharmaceutics and approaches that you're currently on. Today, in the last few shows, we've just been answering questions from you guys, because this is your show. This is for you guys to learn, grow, and take your health, your life, your choices up a notch and to soar with eagles. And we want to be right there with you, leading the way. We'll never ask you to do anything that we're not willing to do. We'll never push you beyond your biochemical limits. We will be right there alongside you to help artistically figure out what's the next right step for you. And at Living Well Clinical Nutrition Center, we're proud of the work that we do, and we're excited about longevity. We're excited about vitality and energy. The fruit of the vitality tree is at your grasp and fingertips. So remember, the fun run Kurt's favorite, the Fun Run Saturday at the Gloria Day Church in Nassau Bay that is sponsored by Anchor Point Ministries, a great organization that supports families, that gives families hope, that helps children, adopted children that are being adopted, or women that have medical need. There's so many aspects of Anchor Point that one-liners just can't cover. You just got to check them out. They got a great story and a great impact on our culture, really, and they do so many great things. And then, of course, the following Tuesday, the 15th at 6:30, we have the baking class at Living Well. Very excited about that. So I want you guys to be a part of it and come and hang out with us so that we can help teach you, train you to see how you can be healthier during the holiday season. So as usual, I'm always glad to be on the show. We'll see you next week at KHEA Radio.
KHEA Radio right here.
The Living Well podcast. So subscribe, and we'll check you later.
You're listening to 99.5 FM KHEA Radio. Coming up, Austin French.